What if a tiny virus hidden in dust could become deadly? A mysterious illness discovered during war, a virus carried by rodents, and a modern outbreak that shocked the world aboard a cruise ship near Antarctica. Today we uncover the complete story of Hantavirus, its history, symptoms, spread, prevention, and the truth about how dangerous it really is. Hantavirus is a rare but dangerous virus mainly spread by rodents such as rats and mice. Humans usually become infected after breathing air contaminated with rodent urine droppings or saliva. The virus can cause serious illnesses affecting the lungs, kidneys, and blood vessels. There are different types of hantaviruses around the world. In Asia and Europe, some strains mainly affect the kidneys. In North and South America, certain strains attack the lungs. The history of hantavirus. The story of hantavirus became famous during the Korean War. Thousands of soldiers suddenly became sick with high fever, bleeding, kidney failure. Doctors were confused because nobody knew what caused the disease. Scientists later discovered that rodents living near military camps were spreading the virus. The virus was named after the Hantan River region. In 1978, scientist Ho Wang Lee identified the virus in field mice for the first time. In 1993, a mysterious illness appeared in the Four Corners region of the United States. Healthy young people suddenly developed severe breathing problems. Doctors were shocked because patients became critically ill very quickly. Scientists discovered a new hantavirus strain carried by deer mice. This outbreak became known as Hantavirus pulmonary syndrome, or HPS. The event made hantavirus famous worldwide. In 2026, the world once again focused on hantavirus after a mysterious outbreak linked to a cruise ship traveling from Argentina. Passengers aboard an Antarctic expedition ship began developing fever, weakness, and breathing problems. Scientists suspected the Andes strain of hantavirus, a rare South American strain that may sometimes spread between humans through close contact. Health agencies launched investigations as fear spread across international news. Early hantavirus symptoms often look similar to the flu. Common symptoms include fever, headache, muscle pain, chills, nausea, tiredness. In severe cases, lungs may fill with fluid, breathing becomes difficult, oxygen levels can fall dangerously low. Hantavirus mainly spreads through rodent contamination. Humans can become infected by breathing contaminated dust, touching rodent waste, or touching contaminated surfaces and then touching the face. Most hantavirus types do not spread easily between humans. However, the Andes strain found in South America has shown rare human-to-human transmission in close contact situations. To reduce hantavirus risk, keep homes and storage areas clean, seal holes where rodents enter, avoid touching rodent droppings directly, wear gloves and masks while cleaning dusty places, ventilate closed rooms before cleaning. Experts recommend using disinfectant sprays instead of sweeping dry dust into the air. Although hantavirus can be serious, it remains relatively rare. Experts say it does not spread as easily as viruses like COVID-19. Most infections happen after direct exposure to rodents or contaminated environments. Awareness, hygiene, and prevention are the best protection. From war zones to modern cruise ships, the story of hantavirus shows how tiny organisms can shape human history. Science continues to study these mysterious viruses to better protect the world. Stay informed, stay safe, and subscribe to KnowBoost for more amazing science mysteries and true stories.